All day long, people without bronchiectasis make mucus and sweep it up in microscopic particles. In bronchiectasis, that doesn't occur with the same efficiency and effectiveness. And so doing airway clearance therapy is providing what your lungs would normally do and keeps that mucus from building up. In the same way that one would do dental hygiene and brush their teeth daily, one should be also doing airway clearance daily. If you feel well, you're doing this to maintain it, and that's a critical piece. You don't want to slowly slide back into a period of illness. And if you're feeling poorly, as if you're having an exacerbation, that's the time to increase the frequency and or intensity of your airway clearance. When the mucus builds up in the airways, that is food for the bacteria. We don't want the bacteria dining at their bacterial buffet in your lungs. This is why it is so critical that you are maintaining your airway clearance on a daily basis. I've had a number of patients who come to see me and have been managed with chronic antibiotics or having recurrent exacerbations almost every other month. By initiating an airway clearance regimen that works for that patient, it changed the trajectory of their entire disease and their quality of life. That addition actually provided them more time and energy throughout their entire life. For typical bacterial infections and bronchiectasis, it's just as important to be performing ACT or airway clearance therapies. That helps to decrease the burden, the bulk of the bacterial disease that is there, and allows the antibiotics to work more effectively. If you're being treated with antibiotics, whether at home or in the hospital, you should try to increase the frequency and or intensity of your clearance. So I hear both, I already cough up mucus, why do I need to do this? And the inverse, if I don't bring anything up, why are you telling me to do this? And so for the first, that amount of mucus that's coming up is really the tip of the iceberg. There is so much more that's in the lung that you're not bringing up. And I think you'd be surprised by the improvement in your chest congestion that you'll notice once we're doing this on a regular basis. This allows you to not appear, quote, sick, which is, I think, a major concern for patients. There's no perfect way of doing airway clearance. That what's going to work is something that you are able to do and that you find effective. And it may take a little trial and error, but once you find something that works, we can stick with that. So recognize we're in this together and we're gonna find a treatment regimen that works well for you. When patients can say to me, I don't wake up at night coughing anymore, my sleep is more restful, they no longer feel like they're a patient and they go back to feeling like they're a person.